You're watching CTOM TV. Knowledge is power.
So another type of sarcoma is called a GIST. It's called a gastrointestinal stromal tumor. So genetic testing of these sort of tumors have found that one of the most common mutations or genes, the most commonly mutated gene in GIST is referred to as KIT. There's another gene that's commonly mutated in this type of cancer called the PDGFR receptor alpha, platelet-derived growth factor receptor alpha. And so what is interesting is that a drug that's used to treat leukemia that happens to inhibit both KIT and PDGFR, amongst other things, it's a drug called Imatinib or Gleevec, and it's been very effective in CML, chronic myelogenous leukemia. It happens to also be quite beneficial in patients who have this GIST, this GIST, that have high expression or mutations in the KIT and the PDGFR alpha. So in this case, you could look at both genetic testing and also RNA sequencing to determine if you have those. And then this drug Imatinib, and there's other drugs like Imatinib, like Nilotinib too, that can also work quite well for this. So, we have a few patients who are getting GIST right now, or getting this for GIST and responding very well. In a recent study, and there's been quite a few different studies, when they gave this drug to patients with GIST, they found that 65 to 70% of these patients had what's called a partial response. The partial response means that some of the tumors responded and some didn't. And when you're looking at a difficult to treat disease, that's really important, because if you can get rid of some of the tumors in one way, then perhaps you can get rid of the others using a different drug or with surgery or with radiotherapy, radiation therapy. So a partial response is a significant finding, and it's not to be ignored. It's not as beneficial as a complete response, but it's still very beneficial. And furthermore, 15 to 20% of these patients achieve what's called stable disease. And these are fairly late stage patients. So, having that kind of statistics for a type of cancer that doesn't really have a lot of other treatments is really, really an important thing. So if you have GIST, definitely get RNA expression testing and or tumor DNA sequencing.
I think it's also important to note here that this is early days for linking, off-label treatments or treatments that were designed for other things. This RNA expression test it's 2 years old.
Yeah.
If that,
exactly. Yeah.
So if there's a part of you thinking, 15 to 20%, there is reason to get excited. Because we're just getting started with exploring all the possibilities. And again, we're just presenting a couple of options just to kind of drop a pin in what's possible for you. But right now, there's a lot more that's possible once you have this information for sure. And in the next couple of years, if anything we've seen in the last 10 years is any indication, it's just going to be exponential growth in these options for people.
Thank you for watching CTOM TV. Subscribe below and stay informed.